If one of the best bodybuilders in the world is doing this, why are most people still ignoring doing this exercise to reduce shoulder pain? Because chances are you either haven't heard of it or you're doing it completely wrong. And I've seen patients where they tried physical therapy and focused on improving their rotator cuff strength and improving muscle flexibility. However, they were still unsuccessful in treating long-term shoulder pain. And this exercise was actually one of the few movements that provided long-lasting shoulder pain relief. But here's the thing, shoulder CARs aren't simply about moving your arm and shoulder as far as you can. I'm Matt Sigwa, a doctor of physical therapy, and in this video, I'm going to explain what shoulder CARs are, how to do them correctly, and the common mistakes people often make when they try to do this movement. First off, CARs stands for Controlled Articular Rotations. Now, the purpose of CARs is to actively improve end-range joint mobility. Now, what exactly does that mean? So essentially that means we're just trying to use the muscles of your shoulder to help move your arm as far as it can, as opposed to using a more passive method where you might be using like a stick to help raise up your arm. But in that way, you're not turning on those muscles. And the reason why we want to perform a movement like a CAR is because we want to improve the stability at the shoulder joint. Now, with the shoulder joint, we do know it's inherently less stable because it has a lot more mobility, right? So you have, 3 degrees of freedom is what we call it. You can move your shoulder forward, back, you can move it side to side, and also there's that rotation component. So 3 planes of motion is where we can move our shoulder joint. So because it's more mobile, that means it's going to be less stable. In contrast, you can compare that to your knee joint, where you can only flex, extend, and you have a little bit of rotation. So that's 2 planes. So because your knee joint is more stable, it has only 2 degrees of freedom compared to your shoulder joint, which has 3. There's a lot more movement in your shoulder. It's going to be less stable. So we rely a lot more on our active structures, specifically talking about your rotator cuff and even like your scapular thoracic muscles, to create a little bit more active stability for the shoulder. Now with the CARs, once you're performing these movements, you're emphasizing the end ranges, meaning not only is your rotator cuff turning on as you rotate your arm, whether that's externally or internally, but you're performing, flexion to the end range. So you're getting the anterior structures of your shoulder, like your front deltoid, but also you have the component of using the scapulothoracic muscles that help you reach far down, so depress, and also as you reach up, you're elevating. So those muscles around the shoulder blade are also working. So you have all these groups of muscles at your shoulder that help create more stability, and more specifically dynamic stability. So whenever we're reaching up, if we're throwing, if we're doing any pressing movements, because that shoulder joint is less stable, we need to improve the activation of the shoulder joint muscles, which is why the CARs is a great exercise, because it activates all the different groups of the shoulder muscles, and more specifically at end ranges. So a lot of people will work on rotator cuff exercises. So for example, external rotation and internal rotation with weights or resistance bands. Those are commonly used. However, those are in positions that are a little bit more safe because they're in more stable positions in relation to like your arm and shoulder, versus as you go into elevated or a lifted up arm, that shoulder is in a less stable position, which requires a lot more stability from your rotator cuff muscles, from a lot of the muscle groups around the shoulder. So the further you get to, that fully in range, whether you're all the way up here, all the way to the side, and especially if you have any kind of rotation, you want to focus on strengthening those muscles in those ranges. And with the CARs, you literally get to end ranges of your shoulder joint mobility, and you're emphasizing trying to go as far as you can in a pain-free range, right? So this is a great way to help activate all those shoulder joint muscles without resistance, and in a way that you're not putting too much load on them. And it's really a great warm up that typically you should be doing before any pressing or any throwing movements, because you're getting to the end ranges that you want to improve the mobility, the flexibility in some of those tissues to get to as far as you can, but also you're using those muscles to get you there. So now you're activating all those muscle groups at the very end ranges, where if you're never raising your arm up that high, well, you might get strong when you're performing like a bench press, but look at this range of motion. You're here and you're here. So you're gonna get very, very strong in that range. But if you ever have to perform a movement where you're up here, like full in range, you're not gonna be as strong or as stable because you're never really turning on those muscles. So doing the cars is a great way to activate those musculature in the end ranges. In this clip, Chris Bumstead, former Mr. Olympia, does a great example of how to perform the exercise. You're going to have your elbow straight the whole movement, starting with your palm facing away from you in front of your body. And then you're going to reach across your body, going up towards the ceiling as high as you can, really trying to emphasize the reach. Once you get above your shoulder, above the head, you're going to rotate your palm the opposite direction. You're going to reach back behind you as far as you can. And then once you get to the bottom, you're emphasizing how far you reach down, and then you just reverse the movement. So one of the most common mistakes that people make with doing a shoulder car is that they'll push through pain and go 100% as hard as they can, trying to reach as high and as far back as they can the very first time that they try this, because this isn't a movement that you're typically doing in your day-to-day. Now, especially if you don't do any mobility at all, you want to warm up into getting the full end range, right? So let's say if you're doing the movement, you're pushing up, you're rotating, you're reaching back as far as you can. In terms of how much effort you want to really push, start off with like 50%, right? You can still do the full range of motion where you're moving along the range that your shoulder can, but you're not pushing into pain, right? You're gonna have some joint stiffness or some tightness in some of the soft tissue around the shoulder the very first time that you try it. So warm your shoulder up. It's very similar to whenever you perform any compound movement, such as like a bench press, where you're not gonna start off with going as heavy as you can, right? So with mobility exercises like this, you don't want to start off as trying to stretch your arm, your shoulder as far as you can right away. Those tissues need to warm up. You need to gradually improve how far and how hard you're pushing your arm and shoulder. So the first mistake is people push into pain and they do too much too soon. So it's a gradual progression. Work your way in terms of how intense you're really trying to move and get your shoulder to reach end ranges. So just build up to it. No need to go too hard too fast. Now, this exercise is definitely not one that you would want to try if you have a confirmed diagnosis of moderate to severe arthritic shoulders and they're symptomatic, where just raising up gives you a lot of pain, or even rotating or reaching behind your back. If you have those types of symptoms and you also have imaging that confirms moderate to severe arthritic or degenerative changes, this is an exercise that you do not want to do. Now, I typically perform cars whenever I'm going to do some kind of pushing or lifting upper body movement. So I'll usually do between 5 to 10 repetitions. So focusing primarily on slow and controlled movements while getting as far range as I can in a pain-free range. There might be some tightness or little discomfort, but the goal is it is essentially pain-free, but with all the movements, it's slow and controlled. All right, if you found that video helpful, please subscribe to the channel and I'll see you in the next video.